Welcome back to Valley Life. I'm Alicia Safias. Today we're talking about getting healthy. We're talking about Medicare Part D and what a success it's been. Scott joins us now. Introduce yourself for us, Scott.
Yeah, I'm Scott Succo, and I'm Vice President of Community Partnerships for Mental Health Systems. And we're really excited the opportunity right now with healthcare reform and looking at programs that are working and kind of steering the conversation into those successes and potentially and where bigger impacts can be made.
Right. Everyone is talking about healthcare. We just came off of an election. Obviously, we have a president that's pushing healthcare. It's a hot topic right now. Tell us about Medicare Part D.
Well, the environment right now lends itself to the conversation. There's a looming fiscal cliff that we're talking about. There obviously needs to be cuts somewhere. And what we want to do is to start the conversation about what programs are working. And Medicare Part D is a phenomenal success. There was just a survey out that surveyed seniors that utilize it for their prescriptions. And we found that over 65% of the seniors that use it would not be able to fill their prescriptions if they didn't have it. And that speaks a lot for seniors. Over half of them have an income of less than $18,000 a year. So when you're talking about a vulnerable population, seniors that have co-occurring chronic illnesses, this is life-saving for them.
It absolutely is. We talk about the prescription coverage, and that's a huge thing for seniors. Tell us what people out there need to know. Who's eligible? What do we need to know about Part D?
Well, seniors are eligible, and it's part of their benefit, Part D. But really the conversation is, as we're beginning the discussions with savings, we are asking the elected officials and the administration to look at all programs across the board and take a very customized approach rather than just cuts across the board. Look at program by program and cut where it makes sense. And we know that it does not make sense to cut the prescription drug benefit that seniors are currently taking advantage of.
Why is Medicare Part D a success? What's making it so successful?
Part of it is how it's reduced costs. So it's a premium that's affordable, it is highly utilized, and it actually is life-saving for the seniors that, according to the survey that we just received back.
What would you like to see happen? You want more people to sign up, or what's your goal?
Our goal right now is to begin the conversation about the fiscal cliff and do not touch those programs that are saving money and having high efficiency and effective treatments available to seniors, and rather steer the conversation into areas that are not working and review those programs and see where efficiencies can be made. There's no doubt that every program needs to be looked at. Cuts are going to have to be made someplace. We think that those programs that are not showing an effective return on an investment, that are not working well, that are not saving the taxpayer money, let's start with those programs first. Let's leave the programs that are working alone, especially when they are serving seniors, which, as I said, are living over 50% are living on an income less than $18,000 a year. This is a population that really cannot do without it, especially given the fact that the majority of seniors have some sort of chronic health condition that they're living with. Prescription Part D is a program that they need.
And in reality, Medicare Part D is actually saving billions of dollars. That's something we don't normally think of when it comes to health plans.
An astonishing amount, $435 billion in savings when you take a look at Medicare Part D, and that represents 11 million seniors that are currently using the benefit. So it has a huge impact for many, many seniors right here in Fresno.
Okay, and also I imagine with your work in the mental health realm, you see success stories all the time with this program.
We do, and when you take a look at the face of someone that is using this benefit, it's a senior, and they might have the primary condition is a chronic disease like hypertension, diabetes that they're managing. Co-occurring with that can be depression. And so we're really concerned that they're not only getting their primary care prescription drug needs met, but they're also getting that depression medication that they need. On the other side, if they have a serious mental illness like bipolar, schizophrenia, severe depression, we know that many of those clients also have co-occurring chronic conditions. It can be because they're not active, so they have diabetes, or that they are smokers. Over 50% of cigarettes are consumed by someone with a serious mental illness. So we know that for lots of reasons, those that have a serious mental illness die 25 years younger than someone without. So our seniors are not immune to that. They're seeing higher rates of depression. So we're just committed to doing what we can as we safeguard a benefit that's utilized by millions, that has effective use. They're rating it high. The Budget Analysis Office is rating it as cost effective and steering the conversation to other areas of entitlement programs where there are not the same types of efficiencies.
Well, thank you so much for joining us, Scott. And again, Medicare Part D, you really welcome everyone to start that conversation. Do the research and find out why it is a success. Thank you for joining us. And Valley Life, we'll be right back.